Management of acute trauma. Welcome to today's podcast, where we discuss the management of acute trauma. Our conversation is structured in a question and answer format to support medical students, surgical residents, clinicians, and all listeners interested in the management of acute trauma. Pause the podcast after each question to attempt answer. Let's begin. Overview. Magnitude of disease burden. History question. Why is trauma considered a major public health concern? Answer. Trauma is considered a major public health concern because it ranks as the fourth leading cause of death in the United States, surpassing deaths caused by the coronavirus disease 2019. Question. What are the leading causes of death for individuals aged 1 to 44 in the United States? Answer. Unintentional injuries are the leading cause of death for people aged 1 to 44 in the United States, with a notable increase in deaths among older adults. Question. What is the economic impact of injuries in the United States? Answer. The economic burden of injuries is significant, costing the United States $4.2 trillion in 2019, which is equivalent to 19% of the country's gross domestic product. Question. How does the cost of injury in the United States compare to other major national expenditures? Answer. The cost of injury in the United States is substantial and is comparable to the combined budgets for Medicare, Social Security, Defense, and Health in 2023. Question. What factors have driven significant advancements in trauma care? Answer. Military conflicts have been a major driver of advancements in trauma care, especially in wound management, resuscitation, and the development of trauma systems. Question. What role has the American College of Surgeons played in trauma care? Answer. The American College of Surgeons established the Committee on Trauma in 1949, which has been pivotal in improving trauma care through initiatives such as advanced trauma life support and trauma center verification. Question. What are some key activities of the Committee on Trauma? Answer. The Committee on Trauma is involved in trauma system development, injury prevention, trauma registry maintenance, performance improvement, education, and advocacy. Question. What is the significance of the American Association for the Surgery of Trauma? Answer. The American Association for the Surgery of Trauma is the oldest and largest trauma professional organization, and it has led to the establishment of acute care surgery training fellowships. Question. Which organizations focus on promoting trauma research and improving trauma care? Answer. The Eastern Association for the Surgery of Trauma and the Western Trauma Association both focus on promoting trauma research and advancing trauma care. Question. What organizations are involved in improving trauma care? Answer. Organizations such as the Eastern Association for the Surgery of Trauma, Advanced Trauma Life Support, American Association for the Surgery of Trauma, American Trauma Society, Orthopedic Trauma Association, American Association of Neurological Surgeons, Society of Trauma Nurses, American College of Emergency Physicians, National Association of Emergency Medical Services Physicians, and National Association of Emergency Medical Technicians are all involved in improving trauma care. Question. What are some common activities of organizations dedicated to trauma care? Answer. These organizations develop evidence-based guidelines, advocate for injured patients, promote trauma-related legislation, work to improve trauma care, and collaborate on projects. Question. What is the main goal of organizations working in trauma care? Answer. The main goal of these organizations is to improve the care of injured patients and to establish a national trauma system. Trauma centers and systems. Question. What is the primary goal of a trauma system? Answer. The primary goal of a trauma system is to transport the right patient to the right place at the right time for optimal care. Question. What are the main components of a trauma system? Answer. The main components of a trauma system include injury prevention, education, pre-hospital care, acute hospital services, rehabilitation, data analysis, performance improvement, and research. Question. How does a trauma system impact patient survival and recovery? Answer. A trauma system maximizes survival and meaningful recovery, with outcomes being highly dependent on rapid access to care. Question. What legislative act was passed in the United States to address trauma system development? Answer. The United States Congress legislated the Trauma Care Systems Planning and Development Act of 1990 to address the need for new or revised state trauma systems. Question. What was the purpose of the Model Trauma Care System Plan released by the Health Resources and Services Administration in 1992? Answer. The Model Trauma Care System Plan provided a template for state trauma system development. Question: what were the limitations of the traditional exclusive trauma system? Answer: the traditional exclusive trauma system, which was centered on large academic hospitals, led to the over-triage of minimally injured patients and underutilization of resources in smaller hospitals. Question: what is an inclusive trauma system? Answer: an inclusive trauma system is a system that includes all hospitals to address the needs of all injured patients, regardless of trauma designation. Question: what are the benefits of an inclusive trauma system? Answer: the benefits of an inclusive trauma system include preservation of limited medical resources, preservation of practitioner skill, and provision of appropriate care within the patient's community. Question: what evidence exists regarding the effectiveness of trauma system care? Answer: the National Study on Costs and Outcomes of Trauma, NSCOT, showed a 20% reduction in in-hospital mortality and a 25% reduction in one-year mortality when care is provided at a trauma center. Question: what is the purpose of the Needs-Based Assessment of Trauma Systems tool? Answer: the Needs-Based Assessment of Trauma Systems tool helps design or create new trauma centers by considering factors such as population, transport time, and community support. Question: what were the limitations of the initial Needs-Based Assessment of Trauma Systems tool, and how was it improved? Answer: the initial Needs-Based Assessment of Trauma Systems tool overestimated rural needs and underestimated urban needs. The updated Needs-Based Assessment of Trauma Systems 2 uses geospatial modeling to improve accuracy. Question: what disparities persist in trauma care despite advancements? Answer: significant disparities in access to optimal trauma care persist, especially in economically disadvantaged urban areas and rural regions with long transport distances. Question: what proportion of trauma deaths are considered preventable with optimal care? Answer: 20% of trauma deaths are preventable with optimal emergency and trauma care. Question: who advocates for funding of a national trauma system? Answer: trauma surgeons, the Committee on Trauma, and other organizations advocate for funding of a national trauma system. Question: what did the National Academy of Sciences, Engineering, and Medicine recommend in its 2016 report regarding trauma systems? Answer: the National Academy of Sciences, Engineering, and Medicine released a report in 2016 advocating for the integration of military and civilian trauma systems. Injury scoring question: what is the most commonly used anatomical system for classifying injuries? Answer: the abbreviated injury scale is the most commonly used anatomical system for classifying injuries. Question: how does the abbreviated injury scale severity code describe the seriousness of an injury? Answer: the abbreviated injury scale severity code describes the seriousness and potential risk of death for each injury, ranging from 1, which indicates minimal severity, to 6, which indicates a fatal injury. Question: how is the injury severity score calculated and what does it represent? Answer: the injury severity score quantifies the overall burden of injury sustained by a patient. It is calculated by summing the squares of the highest abbreviated injury scale severity score from each of the 3 most severely injured body regions. Question: which injury severity scoring systems are used to assess severity, predict outcomes, and guide treatment decisions? Answer: the organ injury scale, the new injury severity score, and the trauma mortality prediction model are used to assess injury severity, predict outcomes, and guide treatment decisions. Question: which systems evaluate a patient's physiological status after injury to aid in triage and treatment decisions? Answer: the Glasgow Coma Scale, the Revised Trauma Score, and the National Trauma Score evaluate a patient's physiological status after injury, aiding in triage and treatment decisions. Question: what are the advantages of the new injury severity score, particularly in predicting mortality for penetrating injuries? Answer: the new injury severity score, which is calculated by summing the squares of the 3 most severe injuries, offers improved prediction of mortality, especially in cases of penetrating injuries. Prehospital trauma care overview question: why is prehospital care considered important in trauma situations? Answer: prehospital care is considered important because optimal trauma care depends on timely intervention, and care provided before reaching the hospital significantly reduces mortality, especially in patients suffering from severe bleeding. Question: how does transport time affect mortality in trauma patients? Answer: for patients with severe bleeding, Shorter transport time is crucial and directly impacts survival. However, for patients whose condition is not clearly defined or who are not in shock, the relationship between transport time and mortality is less certain. Question: what factors must be balanced when considering rapid transport of trauma patients? Answer: the need for rapid transport must be balanced against the risks associated with ambulance travel. Decision support tools such as the Air Medical Prehospital Triage score can assist in determining the safest and most appropriate mode of transport. Question: how does the use of lights and sirens affect the risk of emergency vehicle crashes during patient transport? Answer: using lights and sirens increases the risk of emergency medical service vehicle crashes by 50% and nearly triples the likelihood of a crash during patient transport. Question: what are the primary safety priorities for pre-hospital providers? Answer: pre-hospital providers should evaluate the scene for safety, perform an initial assessment of the patient, determine the best triage and transport decisions, and initiate critical interventions while ensuring safe transport to a healthcare facility. Question: what are common scene safety risks encountered during pre-hospital trauma care? Answer: common scene safety risks include proximity to moving traffic, potential violence, fires, toxic chemicals, airborne agents, and booby traps. Field assessment. Control of hemorrhage. Question: what is the goal of the rapid initial patient assessment in pre-hospital trauma care? Answer: the goal is to quickly identify and address life-threatening conditions by using the mnemonic exsanguinating external hemorrhage, airway, breathing, circulation, disability, and exposure. Question: how is massive external hemorrhage controlled in the field? Answer: massive external hemorrhage is controlled immediately with direct pressure, wound packing, and, if required, hemostatic agents. The application of tourniquets at the scene has shown effectiveness in both military and civilian environments. Question: what is the purpose of the Stop the Bleed program? Answer: the Stop the Bleed program, created by the Hartford Consensus, aims to empower the general public to provide effective bleeding control interventions in emergency situations. Question: how widespread is the Stop the Bleed training? Answer: Stop the Bleed training has reached participants in over 138 countries worldwide. Question: what types of methods are used to deliver Stop the Bleed training? Answer: Stop the Bleed training is provided through in-person sessions, online education, and interactive courses. Question: what is one public health measure to improve bleeding control in the community? Answer: one measure is placing bleeding control kits in schools, government buildings, and other public spaces as part of a public health campaign. Field assessment. Airway. Question: why is airway management crucial in pre-hospital trauma care? Answer: airway management is crucial because failure to properly manage the airway is a leading cause of preventable death in trauma cases. Question: what are the initial steps in managing a trauma patient's airway in the field? Answer: initial airway management should begin with a chin lift or jaw thrust maneuver, followed by clearing any obstructions. For patients who are breathing on their own, this may be adequate. Question: when should oropharyngeal and nasopharyngeal airways be considered in trauma patients? Answer: oropharyngeal airways are considered for patients with reduced consciousness, but there is a risk of losing the airway. Nasopharyngeal airways are suitable for more alert patients but should not be used if there is facial trauma. Question: what techniques are available for airway management in pre-hospital trauma care? Answer: techniques include basic airway management such as bag valve mask ventilation, face masks, nasal cannulas, endotracheal intubation, including rapid sequence and drug-assisted intubation, and the use of supraglottic airway devices. Question: what challenges can affect endotracheal intubation in the pre-hospital setting? Answer: challenges include technical difficulties such as poor visibility and awkward positioning, as well as differences in skill levels among providers, all of which can affect the success rate. Question: why is routine pre-hospital intubation a subject of controversy? Answer: routine pre-hospital intubation is controversial because, although it may benefit select patients, it also carries risks and has variable success depending on the provider and circumstances. Question: what are supraglottic airway devices and when are they useful? Answer: supraglottic airway devices provide airway access without the need for laryngoscopy and are useful for patients who lack a gag reflex. Question: how does the laryngeal mask airway function in airway management? Answer: the laryngeal mask airway is inserted by hand, creating a seal around the airway. but it does not protect against aspiration. Some laryngeal mask airways allow for gastric decompression. Question: what are blind insertion airway devices with 2 lumens designed to do? Answer: these devices are designed to guide a tube into the esophagus, with balloons that block air from entering the esophagus and help to isolate the airway. Question: has the optimal method for pre-hospital airway management in trauma been established? Answer: the best approach for airway management in pre-hospital trauma care has not yet been determined. Question: what is the current state of research regarding pre-hospital airway control in trauma? Answer: research is ongoing, including studies such as the Pre-Hospital Airway Control in Trauma trial, to determine the most effective airway management strategies. Field assessment. Breathing question: how is effective breathing assessed in trauma patients in the field? Answer: effective breathing is assessed by evaluating ventilation and oxygenation, which are monitored using peripheral oxygen saturation and end-tidal carbon dioxide measurements. Question: what does a normal end-tidal carbon dioxide reading indicate, and why is it important in trauma care? Answer: a normal end-tidal carbon dioxide reading ranges from 30 to 40 millimeters of mercury. Low values in pre-hospital trauma patients are linked to increased mortality and a higher likelihood that the patient will require a blood transfusion. Question: how should tension pneumothorax be treated in the pre-hospital setting? Answer: suspected tension pneumothorax should be treated urgently by inserting a percutaneous intravenous catheter to release trapped air in the chest cavity. The catheter is typically placed at the 5th intercostal space or the 2nd intercostal space for patients with a higher body mass index. Field assessment, circulation, transport considerations, and care during transport. Question: why are rapid triage and transport decisions important in pre-hospital trauma care? Answer: making triage and transport decisions quickly and efficiently is vital for achieving the best possible outcomes in trauma patients. Question: what do the 2021 Field Triage Decision Guidelines help pre-hospital providers determine? Answer: these guidelines assist providers in deciding whether a patient needs to be transported to a trauma center, based on injury characteristics, patient physiology, mechanism of injury, and the judgment of emergency medical service personnel. Question: how is the shock index used in pre-hospital trauma care? Answer: the shock index, calculated from heart rate and systolic blood pressure, is a simple and effective tool for identifying trauma patients at increased risk of death who may require urgent intervention. Question: why is pre-hospital resuscitation important in trauma care? Answer: pre-hospital resuscitation is crucial for identifying shock early and starting resuscitation efforts, both of which impact patient survival rates. Question: when does damage control resuscitation begin in the pre-hospital setting, and what is the initial step? Answer: damage control resuscitation begins as soon as the patient is contacted, with the first step being the establishment of vascular access. Question: why are intraosseous devices preferred in pre-hospital trauma care? Answer: intraosseous devices are preferred because they allow for rapid and easy vascular access in the field, enabling the administration of fluids, blood products, and medications. Pre-hospital volume resuscitation. Question: what fluids are preferred for initial resuscitation in the pre-hospital setting, and why? Answer: balanced crystalloids are preferred because they are safer and more effective than hypertonic saline, hypertonic dextran, or albumin for initial resuscitation. Question: what has research shown about the effectiveness of pre-hospital plasma administration? Answer: one study, the Prehospital Air Medical Plasma Trial, found that pre-hospital plasma administration reduced 30-day mortality, while another study, the Control of Major Bleeding After Trauma Trial, did not find the same benefit. Question: how might transport time influence the effectiveness of pre-hospital transfusion? Answer: differences in study results suggest that the length of transport time may affect how beneficial pre-hospital transfusion is for trauma patients. Question: what are the challenges associated with pre-hospital blood transfusion? Answer: logistical difficulties often limit the use of blood transfusion in the field, leading many agencies to use a combination of crystalloids and blood products based on available resources. Question: what is tranexamic acid and how does it function in trauma care? Answer: tranexamic acid is a synthetic form of lysine that reduces the breakdown of fibrin, helping to form blood clots and potentially lower mortality in patients with severe bleeding. Question: what did the CRASH-2 trial demonstrate regarding tranexamic acid in trauma patients? Answer: The clinical randomization of an antifibrinolytic in significant hemorrhage trial showed that tranexamic acid reduced both overall mortality and deaths due to bleeding, though its relevance to trauma systems in the United States has been debated. Question: what has been observed about the use of tranexamic acid in military trauma settings? Answer: in military trauma settings, tranexamic acid has been associated with improved survival and better correction of blood clotting problems, especially in cases requiring massive transfusion. Question: what is the impact of tranexamic acid in civilian trauma care? Answer: in civilian trauma care, no overall mortality benefit has been found for tranexamic acid, but there is a possible benefit for patients who are in severe shock and receive the drug within 1 hour of injury. Question: is tranexamic acid safe for use in the pre-hospital setting? Answer: tranexamic acid is considered safe in the pre-hospital setting, with no evidence of increased risk of blood clots or seizures, and has been associated with reduced need for transfusion and lower mortality. Question: what therapies are available for managing hemorrhagic shock in the pre-hospital environment? Answer: available therapies include pre-hospital retrograde balloon occlusion of the aorta, external compression devices, focused abdominal ultrasound for trauma, and vasopressin administration. Question: what is the main goal of therapies for hemorrhagic shock in pre-hospital trauma care? Answer: the primary goal is to minimize the time to effective hemorrhage control in order to improve patient outcomes. That's it. Thanks for tuning in. If you enjoy our content, please like, share and hit the subscribe button. It's the Everything Surgery Podcast. Dissect the extraordinary.